Metabolic acidosis by Torres. Our goal today is to learn about what metabolic acidosis is, discuss the causes, possible treatments, and the mechanism of compensation. We are continuing to study the urinary system this week and are continuing to build off of what we learned in recent lessons. This week, we are diving into the topic of fluid and acid-base balance of the renal system. The body, as we know, is divided up into various systems. To maintain homeostasis, it is important for there to be a proper balance of the acid and bases. The kidneys specifically have many jobs, including excretion of acid buildup through urination. Sometimes kidneys have a difficult time removing the acids as waste, and is when these problems will happen. When slight changes occur, it typically does not result in anything detrimental. However, over time, as the off-balance continues, or if it grows to an amount that puts homeostasis at risk, is when disease, disorders, and even death can occur. Sometimes the body cannot rebalance alone and medical intervention needs to occur. Today, we are going to dive in to metabolic acidosis, how it occurs, and what is happening when it is left untreated. Metabolic acidosis can occur as a result of a large buildup of acids within the body in those patients who are in critical condition, specifically from kidney disease or kidney failure. Simply put, think of the name. We have too much acids built up in the metabolic system. Therefore, it is named metabolic acidosis. More specifically, the acidosis will occur from the buildup of endogenous acids or even from the GI tract and or kidney losing a balance of bicarbonates. We're going to discuss this in greater detail here soon. The latter of these two is the more common cause of metabolic acidosis. It causes there to be a decrease in bicarbonate or HCO3. There is an ability to have either acute or chronic forms of this disorder. We will go into those, what they both entail because they are different, and what a medical professional should do in the case of either having acute or chronic form of metabolic acidosis. Some patients may be asymptomatic, but those who do display symptoms typically will have an increased heartbeat, headaches, confusion, lethargy, and even an upset stomach, sometimes with nausea. The visual here gives an example of a few of the mentioned symptoms in this condition. You can see the various systems of the body, circulatory, respiratory, digestive, all have different parts that could be a symptom, so it's important to be able to recognize them. Some of the treatments often include ingestion of pills as either sodium bicarbonate or sodium citrate to help the kidney disease from getting any more problematic. These pills must be given from a doctor or medical professional. It is important to determine whether the patient has acute or chronic respiratory acidosis so that possible side effects or unfavorable effects of the therapy can be determined. If the patient has an acute form, the medical professional will want to take a look at the cardiovascular system to ensure no issues occur from there. If more of a chronic issue is the case, it will possibly affect the musculoskeletal system. Causes include diabetic ketoacidosis, when the patient's blood sugar levels are higher than normal, which causes the production of ketones to occur, and ketones are an acid. This is what causes the bicarbonate levels to go down and even further the body, and will hold on to the fluids and waste products. Another cause is loss of bicarbonate, which can happen because of diarrhea. A normal or high ion gap can also cause metabolic acidosis. It is important to recognize if it is a normal or a high gap so the treating physician can treat the cause. The anion gap is usually found by tests finding the amounts of difference between anions and cations. It can be from too much acid produced and not enough bicarbonate. Again, think about diabetic ketoacidosis. As mentioned prior, the body will take measures to maintain homeostasis. In the case of metabolic acidosis, hyperventilation may occur so that the CO2 at the arterial level can decrease. The body wants to expel the waste to increase the blood pH back to normal. The chemoreceptors at both the central and peripheral level will be alerted that the metabolic acidosis has occurred. These chemoreceptors will then work to signal and communicate to various areas of the respiratory system, and this is when the hyperventilation occurs. It is from the arterial CO2 decreasing and therefore a ventilation response being triggered. A large component of this compensation is related to bicarbonate. When the body gets to a place that bicarbonate levels in the blood-brain barrier have reached a normal level, that is when chemoreceptors will do a full force ventilation response. This can take anywhere between a few hours up to a full day in progress. There are formulas designed to measure the amount of maximum compensation in a patient of metabolic acidosis, again relating to the bicarbonate levels as well as the PCO2 levels. Expected PCO2 equals 1.5 times actual HCO3 plus 8 millimeters of mercury. It is important that a person with chronic acidosis is being treated with a controlled ventilation system to maintain the hyperventilation for a given period of time. This is due to the fact that the metabolic acidosis can actually worsen, so the medical professional overseeing the patient should mock the levels of compensatory hyperventilation and thus maintain the partial pressure of carbon dioxide to keep it at a low level. Medical professionals can easily contribute to a potentially fatal outcome in this situation without realizing their error, so it is vital for them to use the formula and compare it to an expected partial pressure of carbon dioxide for a safe measure. This is a chart that I would like for everyone to have in their notebooks. Today, we focused on metabolic acidosis. We will continue to study this condition as well as respiratory acidosis, respiratory alkalosis, and metabolic alkalosis. I want you to be able to recognize the physiology and the compensations for each category. The chart here will help you remember them easier.